Learning when and how to use CPR can be life-saving, and every college student should have the knowledge to act and respond to these situations appropriately and confidently. I'm Abby Roach. I currently hold CPR certifications with both the American Safety and Health Institute and the American Red Cross in infant, pediatric, and adult CPR and AED. In this video, I'll teach you to identify situations in which it is appropriate to use CPR and the steps for doing it successfully. Evaluating a situation, begin by making sure the environment is safe. It is also important to note whether the person is conscious or not, as a conscious person does not need CPR. To do this, gently tap the person and ask, "Are you okay?" If there is no response, check for breathing. If you can feel or hear breath, that person does not need CPR. If the person is not breathing though, call 911 and have someone, if possible, grab an AED. Needing compressions, make sure that the person is flat and on their back. Place your two hands together and center them in the middle of the person's chest, making sure your shoulders are directly above them. Press about 2 inches down for each compression. Keep a steady beat between 100 and 120 beats per minute. Give 30 compressions, and then, if able, give 2 breaths by tilting the chin up and pinching the nose, allowing room for the chest to fully rise and fall. Repeat until an AED or a medical professional arrives, or until you are too tired to continue. Once the AED arrives, turn it on and follow the verbal instructions from the machine. Now that you know how to do CPR, let's address a huge CPR myth. It's important to know that, unlike in the movies, it is extremely unlikely for someone to wake up from compressions alone. Of course, miracles happen, but the point of compressions is to keep up the contractions of the heart when the heart is unable to do so itself. Pushing on the muscle will not cause the heart to restart. An electrical current or a shock from an AED will. Even when you don't have an AED though, it's important to keep up with the compressions to continue to provide the blood to the brain, preventing brain damage until paramedics arrive. To recap, only use CPR when a person is unconscious and not breathing. Give 30 compressions and 2 breaths. When able, use an AED and follow the verbal instructions. CPR is life-saving, and now you have the tools to use it successfully.